farther back.
126.
Yeah.
Super hot, Greg. Hello, welcome to Expert Schmexpert, the show where an expert is going to pretend to know what he's talking about. No, actually, Greg is a medical marvel. I have said this before. I will say it again. And he will then further. I got this. I got it. I promise. This is normally Orion's job. He will explain a piece of information to a comedian. A comedian will then explain it to another comedian, so on and so forth, 4 people down the line in a game of telephone. Is that correct? Do we like that? I like it. I'm getting all the nods from the comics. Rusty doesn't know what's going on today, but that's fine. He'll catch up. My name is Dylan, and you are?
I am Greg.
And how are you today, Greg?
I'm doing okay. I've been inside studying all day, so this is my first contact with human beings, and it's very uncomfortable.
Really? Okay. No, you'll be fine. I promise. I will only touch you when Weinstein tells me I can.
Okay, that's perfect.
I've been reading a lot of his work. So you are in what field?
I'm in medical school.
You're in medical school, that
Yeah.
field. Is there a particular medical field you want to go into?
I'm looking into doing primary care psychiatry or solely psychiatry.
Okay. What's
but
the difference
those are my
between the two?
Primary care psychiatry, actually, you kind of double major in primary care and psychiatry, and it's a 5-6 year long program versus general psychiatry, which is a 4-year program.
Okay. So it seems like you're trying to avoid going to school for an extra year.
I would love to skip an extra year.
Are you tired of it? Medical programs don't seem easy.
I've been in and out of school since 2007.
Okay.
I'm just tired, man.
You're tired. Yes, yes. And so how many years do you have left?
I have less than 12 months to go. I graduate next December.
Wow, I actually didn't know that.
Yeah.
That's amazing.
Yeah, I'm almost there.
Very cool. Good for you.
Yeah.
I don't do anything.
I mean, you're doing this,
That's true.
so
Hello, Twitch.
congrats.
No. I am in school. I at the same school as you.
Yeah.
I would run into you at the gym a lot. Yes.
Yeah, it's been a while.
It
but
has been a while. The last I'm a bad co-host, but I remember co-hosting a stand-up show with you.
Oh, yeah.
And
Yeah,
I think
we
I
did.
may have called you fat.
You did.
I did. Yeah.
Yeah. You, that's the only thing I remember about
That's
you.
that is your
Yeah.
But it was a good one.
It was a good bit, but I'm still mad.
No, I didn't do that. I would never do that. No, you're my favorite person in the world. I know.
I'm glad you said it in front of all these guys.
They need to know.
Yeah,
they need to know.
definitely need to know.
So tell us, what are you going to be talking about today?
So today we're going to talk about 2 very different things, but if I did primary care psychiatry, I would need to know both of these. So we're going to first talk about electroconvulsive therapy, and then we're going to talk about prostate cancer screening.
Okay, and so ECT, as it is abbreviated,
Yes.
If I'm not mistaken, is a bit of a medical, there's a bit of nuance in it because we're not entirely sure
Yes.
how and why things work the way they do, right?
Correct.
Okay.
There's a grant that a local psychiatrist has just submitted that might actually uncover why it works.
Whoa.
Which is a huge breakthrough. But there's a really solid theory on or hypothesis that would explain why it works.
Very cool. Yeah, as far as I understand and from what I can remember, we've been using this in like depression and all sorts of other issues, and we don't know why the hell this thing is working, but it just seems to be.
Yeah, and as the most effective intervention we have in all of psychiatry, it's fascinatingly confusing to everybody.
What is that? There's a really famous woman who was doing ECT, right? It was a celebrity of some sort, an
I don't know.
actress. I can't remember her name. Jessica. She knows.
There's probably a lot of people, a lot of celebrities are probably low key getting it.
Yeah. Sure.
It's just so good. It's like it works like 75 or 70% of the time.
Wow.
Whereas pretty much everything else is 50% or less. So
That is a lot. And so the other thing you're gonna be talking about is the shocker. Is that what you call it in the film?
no, we're just gonna talk about the one in the stink part.
Oh, okay. None in the pink.
The pink that has nothing to do with this.
Yeah, there's a lot of men in this room.
Yeah, it's dudes only.
Dudes only.
Well, it's really
color
anybody.
circuit way.
It's really anyone with a prostate.
Okay.
So, but anyone with a prostate could be could benefit, I guess, from some of this information.
I am excited to hear about this, and the most exciting part to me is knowing that you teach people how to do this, and you use physical models.
Right, we have a fake butt.
There's a fake butt, right?
There's a fake butt with a real fake butthole and a real fake prostate that you can lube up your finger and give it a feel.
Jared wants to see it right now.
It's down in a room we call on campus the Bat Cave.
Nice. Yeah. Robin's down there a lot.
Yeah.
So you heard it here. It'll be a first on Twitch ever live prostate exam by Craig Show.
Yeah.
We have a group of comedians over here that we will introduce. Hello, comedians. How are you?
Hi.
You are?
Jared Berniger.
You are?
Tim Wolf.
You are?
I'm Phil.
You are?
I'm Rusty Rutherford.
Why is your name so goddamn long, Rusty?
It's really long. It's a white person thing.
Yeah, it's a white person thing, he said, and he really emphasized that white. It's a white person thing. So this is our group of amazing comedians that are going to listen to Ziomek one at a time. No, rather, Ziomek will be speaking to who first? You first. So the rest of you, get on out of here. Get out of here. And we'll get this show on the road. All right. Yes. Okay, I'm back on the couch. I'm using both mics while Greg gets ready.
Can I just put some notes up real quick?
Greg can put some notes up real quick. Greg is going to signify, or rather, our lecturer, our expert at the moment, or our Schmexperts, will signify that they are just that with a lab coat. So you may have noticed earlier that Greg was wearing a lab coat. That's actually my lab coat. I bought it in the female section of a nurse store. I think it was it was a store that had a lot of lab coats and things like that because I am a small person. It was cheaper also. I don't know why female clothing is cheaper than the male clothing. And yeah, I think our expert is ready. He is left-handed. His name is Greg Ziomek. Okay. Take it away.
All right, so ECT, that's electroconvulsive therapy. So let's start with why you would do it.
Sorry. No. I think you're fine just so long as your mics are on. 5 minutes on the clock. I forgot to mention that. You will have 5 minutes to explain ECT.
Okay. Should we go now? Yeah. Okay. All right. ECT, electroconvulsive therapy. So first of all, why do we use it? Well, the major use is for treatment-resistant depression, but it can actually work in any kind of acute psychotic state. So people have depression that ends up kind of having psychotic presentations, and those are the people who respond the best to it, who often don't respond to other things.
Like the Ramones.
Exactly, like the Ramones.
Give me shock treatment.
I don't know if anyone in the Ramones actually got it, but I think Dee Dee Ramone probably needed it.
Probably should have.
Yeah, but so there's that. But also interestingly, it's also used for seizures that don't react to treatment. So people have these really long seizures that are usually what we call subclinical, where they're not shaking their body around, but they're actually having seizure activity.
Sad day when you're not shaking
And
your
it's
body around. You gotta live life.
Exactly. So those are some of the indications to use it, and then the way it's done is you have an anesthesiologist at the head of the bed managing the airway of the patient to make sure that they don't stop breathing, and then they get a paralytic medicine that while the medicine is going in, there's a blood pressure cuff around the ankle, and that gets puffed up so that it prevents the drug from getting to the foot.
Are you sure this is an Eli Roth movie?
It could be an Eli Roth movie if I know who that was.
It's the Gorno guy did Hostel.
Oh, really?
Yeah.
So we pump up the blood pressure cuff, and we deliver the paralytic drug.
Continue.
And then we deliver the shock, and we usually use what's called right unilateral placement. So that's one electrode on the top of the head, one on the right side, because we assume that language is typically stored on the left side of the brain. And so in order to to not cause deficits in language function, we try to avoid getting that area involved.
Sounds political.
It's quite political. And then we have, in case the seizure doesn't stop, we have medicines to stop the seizure. But we need to have some amount of seizure activity. So there's an electrical or there's an EEG monitoring the electrical activity of the brain during this whole time. And so once the paralytic drug has taken effect, we can then go ahead and deliver the shock. And then we then just wait for the seizure to
Watch
end.
it burn.
You wait for the seizure to end, and you know the seizure is done because the foot will stop moving.
That's how you know a lot of things are done
Right.
with the human body.
Yes, when they just don't do anything anymore.
And
This one, in this situation, you also having that EEG, you look at the seizure activity within the brain itself. So you have that subclinical portion that doesn't actually present itself outwardly, that's actually still happening. So we need to make sure both are done. And then the anesthesia team just helps wake that patient back up, and then we send them on their way. Now, one of the major caveats of doing electroconvulsive therapy is some of the side effects are a little intimidating for people, but the side effect profile itself is pretty mellow. The number one thing that it causes is an amount of anterograde amnesia, and it's transient though. So after about a month, you stop having amnesia symptoms, and your cognition is restored back to its sort of normal health. And typically, because depression affects how your brain functions, including your thoughts and thought process, people often end up thinking more clearly afterwards, back to their baseline before they got depressed.
this is like Eternal Sunshine of the Spotless Mind. You just
I don't
wanna
remember
forget.
how that movie happened.
You just want to forget. You just fuck up your brain so you forget your ex-girlfriend.
Oh, yeah.
And then you think more clearly because you broke
1
up.
minute.
So the nice thing about that is that it does go away. And there are now studies looking into, can we deliver a shock that doesn't have to cause so much cognitive side effects? One thing that we're looking at now is the amplitude of the charge that we deliver. And can we get a treatment effect with lower amplitude shocks, so that we still get the seizure to happen, we still get the brain activity to go, which is all part of the efficacy. But then we also need to make sure that, or try to find ways to reduce side effects.
But that's not very metal. You got to turn up to 11.
I mean, that's where we started in the 1930s.
Then
It
you
was
got to go
definitely-
to fucking... That was so metal. Let's go
5
to 12.
seconds.
Now we got to go to negative 11.
All right, time is up. Very good. If you want to put that microphone down, just on the floor, I don't really have a place for it, and then take that lab coat off. Yeah. Thank you. That was a lot of fun. I learned a lot, definitely, just watching and listening. So come on, sit on the couch with me, and then Tim, if you want to go grab that next.
Yeah.
What do you?
Grab that next comedian. So, how did you think that went? Were you able to get all of your information in there?
I skipped some of the more technical aspects because I think I ended up throwing a lot of information at him.
Sure.
But I wanted to sort of stick to the general script and make sure we got to the highlights, so I'm not just making it sound scary.
Yeah. So you were only like being mildly scary.
Yeah.
Okay. Not okay.
We could have gotten into much darker places with it.
Sure. Well, that might help. That might help our first Schmexpert, Mr. Tim Wolf,
That's right.
who is going to be explaining all of this same exact information, word for word, really, to
Perfect.
Mr.
But creepier.
Yeah.
Jean Tet, and much creepier. Let's give it a shot. We got 4 minutes on the clock, and go.
We're talking about ECT, not EZE. But the ECT...
Is that like ECW?
How's he doing so far?
Both of them, they all died of AIDS. That's the whole point.
These are all the things that I
But
said.
electrocognitive therapy. Why would you do that? Well, if someone's depressed, if they got any acute psychological, psychoactive, psycho crusher from Street Fighter, then you probably want to help them out because they're all fucked in the head.
Gotcha.
Also, if they're having seizures.
If they're having seizures,
Yeah,
you wanna
because that's in
shock
the
'em?
brain too. Well, yeah, I'm gonna get to why. This
Okay,
works
sure,
great.
yeah.
We don't know why it works,
really
but it
wanna
does. So if they're all jacked in the head, you can shock them into submission. I mean, make them better.
Yeah.
So how do you do it? You got to strap them down.
Uh-huh.
Because that's, of course, how we're going to start this.
Yeah.
You got the anesthesiologist up at their head. They're not they might massage it, but mainly they're keeping their airway oopen because they stop breathing, you get sued.
Oh,
And
yeah,
There's
yeah.
only some places you can hide the
Michael
bodies.
Jackson, yeah,
That's
we
right.
don't want that to happen.
Yeah.
again.
No, not again.
Not again.
So the doctors at the end of the bed, they're the real sick fucks. They're going to be putting like these huge
Doctors at the end of the
bracelets that block the blood on the ankle.
Like tourniquets?
Kind of, sort of. I don't know. They don't lose a leg as far as I know.
Uh-huh.
Meanwhile, somebody's like, they're all political, and they only want to stab the right side of the head with the electrode.
Oh, okay.
Because of where the language
away.
is. I mean, I'm
Yeah,
sure it's
right.
very precise.
the left
Yeah.
side?
Well,
Well, no, the right side is the common because of where the language is stored, and damn liberals, and on the right side, damn conservatives. You know, on
Right,
the right,
yeah,
the
yeah.
right is violent. They
Right
want to
is violent.
fucking
Gotcha.
shock the
Yes.
shit out of this
They want to
person.
do that and take your taxes.
To make them stop being sad and or shaking, because you could be like seizing up and not moving your body like fucking Shakira.
Yeah.
It's very sad. They want you to be able to
They
be
want
happy.
you to Shakira it up.
They
yeah.
want you to
I remember when you talked about Shakira.
They're gonna
Yeah.
shock your right side
Really
of your
nice about
head.
that.
Right side of your head.
The electricity is gonna go
Yeah, she's
through
she's so
To the left foot or the right foot?
the whole body, baby.
The whole
We're
body,
We're just
okay.
gonna light up that nervous
Well, wait, didn't you
system.
say there was something on the foot?
They put an ankle thing to
Like an
stop the
ankle
blood.
bracelet?
Yeah, it's a big,
Okay.
heavy ankle bracelet thing. It's big and it's heavy.
Whoa.
It's
Spirals.
like an Eli Roth movie. Like I said, it's like a Gorno movie
Okay,
from the early
yeah, yeah.
2000s. You
Yeah.
know, you got to put all kinds of stuff to freak out the patient and make this as painful as possible.
Gotcha.
That's why insurance is expensive.
That makes sense, actually.
Right. So side effects may include losing your memory for a while, getting amnesia.
Oh.
It comes back and you think clearer,
Whoa.
like breaking up with your ex.
Oh, wow. You're like, you know what? Fuck that.
Yeah,
Fuck that
so
girl. I
it's
was
like
right.
it's like the brain chemistry form of breaking up with the bullshit in your own head.
Oh.
But you've got to kick out that shit out of the apartment that's in your head
Uh-huh.
using electricity.
So electric shock,
Department of the
electric
mind.
Department of the head.
conjugative,
You have 1 minute.
conjugative therapy.
Cognitive?
Cognitive therapy is basically like moving out your bad brain memories, which are your ex, into her own little one-bedroom studio apartment.
yeah, you might send her a
One
check
bedroom
every now
studio's
and
not
again,
the
but but you're not going to go too crazy.
Okay, I
And they're
gotcha.
trying to figure out ways to do this with lower amplitudes, like less voltage, less
Yeah.
energy. But I say that's lame as fuck because you got to get metal. You got to turn to 11.
Metal.
We got to go to 12. We need to. If you can't smell the patient, you know they're not cooked yet.
30
All right.
seconds.
So it goes 12 is the highest.
I mean, we don't know. They want.
We don't know.
They want. They want to turn. They want to turn to easy listening ECT. They want to turn it into like,
Easy listening.
you know, who the hell is that guy? That one folk singer. A folk singer ECT.
Uh-huh.
That slowly cajoles your ex-girlfriend out of your
God.
brain.
Okay, so
Like
Who the
like
fuck?
James
I can
Taylor.
say- yeah.
Like
That's
James
5 seconds
Taylor.
to figure him out. Oh, they got it. James Taylor.
James Taylor,
Taylor.
ECT. All right,
Hopefully
Phil.
he'll subscribe.
And
so.
That's right.
Those are his
time.
initials.
All right, Mr. Tim Wolf, good job. Can you take off that lab coat and hand it over to Mr. Phil over here? Yeah, is it better? Do we like it better than that? The stand? The stand was just in the way. Yeah. Cool. Yeah, and a good thing we didn't like use much of the whiteboard because most of you are not left-handed. That's true. But you are more than welcome to use more of the
gonna use
whiteboard
more
later
whiteboard
on.
on the next
How did that go?
It was fabulous.
It was
He
fabulous.
got all of the words right in ECT right
yeah,
off the
he
bat.
managed to get every pop culture reference in as possible.
Yeah, well, he squeezed in more, which I was impressed by.
Yeah, there's more pop culture than
Yeah.
you. You didn't mention any.
Yeah, well, you know what? He skipped the Ramones. Now that I think about it, we
true.
went
talked a little bit
we went
about it.
hard for 10 seconds on the Ramones, but like we really got deep into it. Even
you-
made a reference to specific Ramones.
Yeah, I remember that. I
Yeah.
remember that. That was a good time. It was only 5 minutes ago.
I know.
Did you
well,
have a favorite part of that lecture?
This lecture, I just feel like Phil's face.
Oh, that was the face. It was the face.
Zoom in.
Yeah.
What the fuck?
All right. So we have Mr. Rusty Rutherford here that is going to take in all of the information that was passed from Greg to Tim and then to Phil. So let's get started. We have 3 minutes on the clock. And go.
First of all, I'm going to go ahead and swallow my gum because I keep doing these podcasts and things with my gum.
Would
in
you
my
like a
mouth,
tissue?
Which is not very
don't
nice.
do
Yes, I
gums.
should probably do that.
There's
So,
some-
but I'm going to go ahead and kill a little bit of time because I feel confident right now.
That's good.
In whatever the hell it is.
Do I have to remember this?
So basically, ECT, electric cognitive therapy, or it's like the ECW of getting your brain back
Extreme
together.
Championship Therapy.
Exactly. Yes. Perfect. Exactly. Now, why do we do that? You might ask. You might say, like, "Hey, Phil, why the hell do I need to have electrical shock therapy?"
About
And
to say why.
I will tell you because
Those
it's much.
markers are real bad.
Yes, they are. I will tell you. It's because why the bad thoughts are like an ex-girlfriend. God damn it, this thing.
Just like my ex, not
Yeah.
showing up.
Terrible and not showing up. So let's say these are your bad memories or your bad thoughts, the bad
give you a
behaviors. I'm
different
gonna put
marker.
B for bad because
There's
like
a red one. Try that.
then we're gonna it's killing my time.
24 seconds left.
Shit. So this is like why we do this. It's to shock the right side of your brain, into behaving correctly because the right side is the best. The right side is the one that's like the right wing side. So we
Yeah.
got to suppress that side and
Sure.
bring out the liberal, the left side.
Oh.
Lefties. Maybe you're just bad with markers.
I might be.
Okay.
Maybe. I don't know. Anyway, so the left side is the one that has all the other important brain information
Right.
that we need.
It's the
like how
Bernie
to-
side.
Yes, the Bernie side. Yes, this one feels the burn. The other one feels
It's
all
just
the
yelling
pain.
at women on Twitter. Is that the
And so why we do
side.
it is we
left
do
side.
this to basically restart your brain into thinking correctly. How do we do it? Well, I explained a little bit of that. So you got to go ahead and get you strapped down. We're going to have somebody here, and you got to have a lady here because, you know, she's a lady. She's got to help you out
Sure.
over here. And
She's
I'm
much
gonna
smaller
put-
than the man.
Thank you. Well, it's at a distance. Anyway,
I got it.
so she's the
Perspective drawing.
anesthesiologist.
yes?
So the anesthesiologist
Big
will go
word.
ahead and she'll put you under to make sure that you get all the right. That way you're not in too much pain. Except I was explained that this is supposed to make the most amount of pain, and then we put a little tourniquet here on the right leg, I believe it was, and it's done by the
It's left,
sickest
it's the left
doctor.
that you drew it on. but-
Yes, the camera will pick it up. Probably won't. And then we got the doctor, and this doctor is a real sick bastard.
It's Greg, right? This is Greg Geomic right here.
Yeah, that's him. He said that's his job, is to make sure, you know, it's a big middle finger.
Kissed.
There we go. Big middle finger.
So we got 10 seconds. You
Cool.
want to do the what?
Yeah.
10 seconds.
So then the what is, what does it do? It restarts your brain into thinking correctly. You'll have temporary memory
And
loss.
time is over.
Okay. Cool. Cool.
All right, thank you so much, Mr. Phil.
I feel
If you
pretty,
could hand over that lab coat.
Educated. They should
How
call
do
you
you- how do you feel,
Dr.
Rusty?
Phil. Call him Dr.
Dr.
Phil.
Phil.
huh?
Dr. Phil.
Yeah. You should, man.
So how'd you think that went, Greg?
I was really impressed by these drawings. I couldn't really see them until just now, but they're accurate.
Yeah, this is more than you drew for sure.
Yeah,
Yeah,
no,
because
that's
you
true.
drew nothing.
I didn't draw anything.
You didn't draw anything. But
I like the theater of the mind.
yeah, you know what? I was really surprised by Phil's perspective drawing. That's more than what I expect from Phil. Knowing I didn't know he was a goddamn artist.
Mm.
Yeah, that's true. Do we have our fourth comedian? Yes. Let's get him at least set up out here. That'd be cool. We have our fourth and final comedian of this section of the show.
Section.
And his name is Jared. Jared, what's your last name?
Berniger.
Jared Berniger, local improviser. One of my favorite MMA fighters. So watch out, Mr. Rusty.
Try not to piss
0-0.
this dude off. Nice. Undefeated.
Undefeated.
Yeah, undefeated. So how many minutes on the clock? We got 2 minutes on the clock this time, and I feel like you have all the information you need.
Yeah.
Yes.
Yeah.
All right, let's get it started. 2 minutes.
All right. You do MMA. You're familiar with Extreme Championship Wrestling.
Yes.
This is extreme cognitive therapy.
Okay.
And so, why do you want extreme cognitive therapy? Well, mainly there's two sides of the brain. There's the right side and the middle, or the right side and the left side. This works towards the
That's
right
actually politically
side.
true, but
The right side of the brain, and what it does is blocks every information coming into the right side, so you don't get right-wing conservatives elected as president again if you do this correctly. So, but the left side, that's your creative side. That's empathy. So if you do this right, you're going to be a more empathetic person. You're going to be more creative. You're going to be like a Bernie Sanders supporter.
This part has been destroyed in the gym. I'm not very empathetic.
That's why you probably need this. And so they're going to put a little shock to this. Bam, empathy's back. Okay, you can. You'll feel bad about guillotine people getting a triangle choke. You'll be like, I can't do this, man. This hurts them.
Makes me cry.
How do you do this?
How I want to know how.
I'll show you. Okay. So you
Please tell me.
you have a lady come
1
over.
minute.
You have a lady come over and she ties you up. You familiar with the bondage?
I am.
So
It's my favorite form of porn.
cool. She's gonna tie you up into a bunch of different things,
That
and
seemed just
then
genuine and
Greg's
honest.
gonna come in here, and Greg's gonna prod you. The Dr. Greg, this is whoever the doctor is, in this case, Greg. And this is the most
Chinese.
painful part, but you're gonna be put under. That
People
way, it's
used to
only
think I
kind of
was
painful
Chinese
because you're
when I was
like
a kid.
half asleep. Yeah,
White
a lot of
people
doctors
and
are
Chinese?
A lot of doctors are Asian.
Yeah.
This is going to be the most painful part, but still not that painful. So now you're probably wondering, okay, this is why we do it. This is how we do it. But what the hell is extreme cognition therapy? Extreme cognitive therapy is a type of therapy
10
that
seconds.
works on your cognitive lobe. So you know the full frontal lobe is up the
5,
front. The cognitive
4,
lobe is the right side.
3,
So what is it?
2,
It's therapy for your
1.
cognition.
All
Okay.
right. Very good. Very good. I liked it. Thank you, Mr. Rusty. How did you feel? Did you feel confident?
Yeah, I feel like I probably explained even a little more than Greg did because I do have a history of going to therapy.
For those of you that did not catch that, Rusty is smarter than Greg,
and he's got problems.
and he's got problems.
Yeah.
99 of them. So yeah, you are going to be the final student of this round. I will take this. Rusty will give you his microphone, and Rusty will give Jared Berniger
Berniger.
the lab coat.
Just sounds like you say burger weird.
Burger.
Better than what other people think it says. So.
Yeah, he's been hitting
Oh,
the head.
oh, okay.
Been hitting the head so many times.
See, I
in
just
these
went. I
ads.
just went the fun, silly boy route. But there's a dark side to everything.
Oh, I just got it.
That's- yeah.
There is a dark side. Thanks, Greg. Good job with the pun.
Okay.
Sure, Greg.
I'm that good
You're
that I
that
just
good.
slipped that in there.
Comedian, slipping it in there, Mr. Greg Jomek. So, Jared, how do you feel?
Prepared.
You feel prepared.
So prepared.
That's good. Are you ready to explain this to
Sure.
to a seemingly unknowing student?
Yes.
Yes, that is a yes.
Yes.
That is a yes.
That is a yes.
Yeah,
I'm
yeah,
guessing
yeah.
I
Let's
just
let's erase it, and you can interpret it and draw it in the way that makes you feel comfortable.
I will most definitely.
Especially that bottom one there. I don't know what that was.
That
was an interesting
for
drawing.
next
That's for the next one.
one.
We've already moved on in the process.
Yes.
All right. Are you ready, Jared?
Sure.
2 minutes on the clock, and you may go.
Okay. Well, you know about wrestling, right?
Yeah, I've heard about it.
Okay. Well, this has nothing to do with wrestling whatsoever.
Okay, cool.
So
I've heard enough.
Extreme cognitive therapy. Why do we have extreme cognitive therapy? Because a lot of people are really fucked up out there, and so they need to get that part of their brain fixed.
Like extremely fucked up.
Extremely fucked up, especially me. So there's two lobes, right?
Uh-huh.
There's a right lobe, and it has lines that connects it all.
Mm-hmm.
And then the left side is where all your empathy. This is what I was told was the empathy that just like like you're sad, you wanna help out another person, you know.
Craig now
that-
knows
that
what
was
empathy
jacked
is.
up.
Yeah,
So what they do is that's basically it on why you need it, because your empathy's
Because
broken.
there's
1 minute, Jared.
Oh man, shit! And how do you do this?
Yeah.
You get yourself, because apparently, you actually get an Asian man,
Okay.
right? And then he's like, oh,
I remember that. I remember Rusty saying that.
he ties you
All
up.
those things for real.
He ties you up. Apparently, that's your bondage part because
Oh,
we
okay.
were talking
Oh, I
about
thought that
also
was
the-
my dick.
Yeah, that is your dick.
Oh, okay.
Because we need to cuckold it.
We got to take care of it.
Yes.
Cuckold.
So you're all tied up. Well, that and then you're the Asian man is shooting the electrodes right into your brain. And what is it? It's obviously
15
electro.
seconds.
So it's just lightning bolts going into that part of the brain. And these are like the most fucked up lightning bolts I've ever just seen in my life. But that's
Those are the
what
ones
makes-
that they shoot or the fucked up
5
ones?
seconds.
Yes, and that's going to make you get more empathetic.
Okay.
And time. Wow, that was perfect. Thank you, Jared. Greg, why don't you join me back here on the couch?
Okay.
Let's get all the comedians out here, and we'll talk about how fantastic that was. So, first off, Greg, how did this go generally?
Well, off the rails almost immediately.
Really? None of that
With the well, because the convulsive is the C, and everyone went all in on cognitive.
Does it have anything to do with your cognitive?
Just the side effect profile is the cognitive dysfunction.
So you can get cognitive dysfunction
so
from.
We kind of did the.
That's what we were
you
talking about,
remember the
actually.
last thing I said, which was talking about cognition, and so then you just replaced it with the C of convulsive.
There was a lot
Electric
of
convulsive therapy.
Electro.
electro.
Yeah, I totally butchered
So
that.
the
said
topic
electro-
of the day
No,
just was not involved in any of the vernacular, is what you're saying.
Yeah.
Yeah.
So you started off just in like a different ballgame.
But we got the part where we shocked the shit out of
But
them.
you did nail the right, like the tourniquet on the right leg.
Oh.
Which is actually
Somebody drew it on the left leg,
standard.
I did,
definitely.
yes.
Yeah.
Well, yeah. The
I did
you
say
did you did it
That's your
stage
technique,
left.
yeah.
but you
Yeah.
did it to
Stage
your
left.
right.
Yes.
Stage.
I like to do that
I'm the
in clinic
theater.
if I'm like,
Yeah.
yeah. I was like, no, it's stage right. I'll tell patients shit like that.
Yeah.
No, they.
But we're the house. We're the house in this context.
Did they get anything else right? I'll
we
take that
talked
as a
about
no.
The cognitive side effects.
Okay.
They talked about using the right unilateral placement and left side for language, and I think that was really the extent
Only.
of it.
There's two halves of the brain, the right side and the middle side.
And we had
the
Right. That was my favorite.
We
had
middle brain.
Yeah.
the amplitudes.
Oh, I forgot to. Yeah,
Oh, yeah,
I
the
forgot to
amplitude
mention that.
part.
Yeah.
So it never got past the first
Yeah.
person.
Yeah.
Because nobody wants to turn it down. Everyone wants to turn it up.
Turn up that amplitude.
And then I think you guys both talked about using it to treat seizures too.
Is that true?
Yeah.
Oh, okay, cool. That's
It's not
interesting.
common, but it is used.
Okay, that's actually really fascinating. I don't know why.
Yeah.
I'm just like when your brain's
the whole
fucked
thing
up,
is
just
really-
zap it. Yeah.
Just zap it back into place.
Yeah.
So overall, what grade would you give? I'll give the final grade at the very end of the year,
Okay.
but I'll give you a semester grade.
Okay.
Um,
I'm gonna have to
for
go
this.
with a solid D minus.
solid D minus. So they wouldn't be able to move on to the next
They'd be
class.
very close, but yeah, they're gonna have to remediate.
My parents are
All
going
right.
to be so mad.
I think I know a way of remediating this, and that is taking a second semester's worth of
Okay.
classes. So what's the second class you're going to be teaching them,
So we're
Greg?
gonna go into the primary care world and talk about prostate cancer screening.
All of our favorite topic. Everyone's favorite topic.
It's on everyone's mind right now.
Yes. So who's our first comedian that's going to be up? Jared? Jared, do you feel comfortable talking about this? You know, if you want to excuse yourself, you are welcome to. Oh, yes, I'm very sorry. I need to get Greg back here. This is my first time hosting. I need
Like
to...
an intermission, right, or something?
Yeah, you should come back. Somebody can erase that board. Yeah, we have a little bit of an intermission, so thank you very much, Mr. Phil, for helping me out there. So we are now in the Who Wants to Be a Dollionaire phase. Mr. Greg,
Yes.
how are you today?
I'm doing well.
This is my best Regis Philbin impression, by the
Oh,
way.
okay.
I don't know how to do it. Hey, does he do that?
Yeah, he does.
Yeah, yes. Okay, Greg.
Yeah.
Greg, little Greggy, you ready?
You were real close.
Did I lose it? Did
You
I lose
lost
it somewhere?
though. I think you slipped off.
Great question number one. I got hair in my mouth doing that actually. I think it's partly the Hulk is what I'm getting at.
Or Macho Man or something.
Yeah, Macho Man Randy Savage. Little Greggy. Question number one. The average person does what 13 times a day? A. Poops. B. Eats. C. Laughs. Or D. Opens a door.
Shoot. I want to say.
I would repeat all the answers, but I don't remember most of
I'm
them.
going to say C. Laughs.
C, laughs. That is correct. The answer is correct. The answer is laughs. Laughs today. The average person laughs 13 times a day. Shut up, Phil. I made up all of the rest of them. I have the word laughs here, and that is it. I just know that part is correct. So very good, Greg. You now have a variable granted to you. What can you do with this variable? Well, you can throw this in much like a wrench into a spoke. I think that's the expression, right?
Yeah.
Much like a stick into spokes. So when these gentlemen are giving their explanations, you are allowed to throw in said wrench. I will give you those wrenches and variables at the end of this game. Are you ready, Greg, for question number 2?
Let's do it.
All right. On Sunday in Florida, this has to be true. It is illegal for a single woman to do what? This is from triviacountry.com. It sounds legit. A. So legit. Let me read that question over again. On Sunday in Greg! On Sunday. Question number 2. On Sunday in Florida, it is illegal for a single woman to do what? A. Bungee jump. B. Skydive. C. Go to church by her lonesome. Or D. Fornicate with a mule. Greg, would you like those multiple choice? Nope, you don't? Okay.
I'm gonna go D.
D. Fornicate with a mule. The answer is skydive. And I'm sorry, it is incorrect. You lose that question. On a Sunday in Florida, it is illegal for a woman to skydive. TriviaCountry.com. Check them out.
What are they doing out there?
What do
That's
they
why
do?
that state's so fucked up. These ladies got to skydive.
Ladies got to get off on her skydiving. And they can't do it there. Not on that day, at least. All right. Are you ready? Hey, Greg. Hey, Greg. Hey, Greg.
Yeah.
Are you ready for question number 3?
Okay, let's do it.
All right, let's do it. What is Johnny Depp afraid of? A. Pumpkins. Hard P. Pumpkins with a hard P. B. Ewoks. And by that I assume Ewoks from the franchise Star Wars. C. Himself. Or D. Clowns. What is Johnny Depp afraid of?
He's afraid of clowns, D.
Johnny Depp is, in fact, afraid of clowns. Very good. You did it. Okay. Johnny Depp is afraid of clowns. He's not afraid of himself. He loves himself. Probably too much. That was our 3rd question, I believe, right?
Uh-huh.
Okay, I'm good at this. Let's see. I want to pick this one right here because it is funny. Are you ready? Are you ready?
Every time I'm startled.
I'm going to pick up this persona and really roll with it.
Just keep it. Just really.
This is my new thing. Question number 4, Greg. In Texas, it's illegal to swear in front of what? I feel like I stumbled on a word there. I'll try saying it again. In Texas, it's illegal to swear in front of what? A. Corpse. B. Zoo animals. C. Johnny Depp. D. Skydiving. In Texas, it's illegal to swear in front of what?
I'm going to go with A, but my immediate instinct was Johnny Depp.
Your immediate instinct was Johnny Depp. Are you sure?
But I'm going to go with A.
A is your final answer. A, corpse.
Corpse, final answer.
The answer is A, corpse. Hey, you did it. Good job, Greg. So you got 3 out of the 4 questions correct. I don't remember most of the questions, but I do know that you are very good at this game.
Okay.
So what does that mean for our comedians? Well, let's get our comedians up, and let's get you up, and I will explain to you right before you get started on the second phase what you can throw in as wrenches. Actually, why don't you get started, and then I'll tell you the wrenches after you're done, because then you'll remember them more better.
Yeah. Perfect.
Thank you, Greg. Tell me how good I am at this, Greg.
You're astounding.
So good. I know. I was meant for this. I was meant to host a show called Schmexpert every Monday at 7 p.m. MST on twitch.tv/Color Circuit Live. Greg is going to be talking about prostate cancer here in a second. And it is his favorite topic. Every time I'm out to dinner with him, when we're on a boy date, whatever it is, he's constantly talking about prostate cancer. And I just wanted him to get this information out to the world, and I'm glad he is. And so Mr. Greg Jomek, as he gets ready to talk to our very first comedian, Mr. Jared Berniger, I believe is how he pronounced his last name, he is writing some notes on the board, in which, again, Jared Berniger will hear this information and then re-explain it to our second comedian of the night, Rusty Rutherford, who will then explain it. Hello, Snappy C, how are you doing? Who will then explain it to Phil John Tett, who will then explain it to Tim Wolf. I believe that's the order, if I have that correct. Let's see. What else do I know about Greg? Greg is super funny. He runs a show every other Saturday night called Greg's Comedy Basement. I will be coming up soon, actually. I think in February or March. I'm coming up within the next month or two. And that I'm doing a set at his house, a stand-up. That is, if you are local, please check out Greg's Comedy Basement. I don't know how this thing just really fucking took off. He's scheduling like 3 months ahead of time, which is pretty awesome. Shameless plug. That's true. But it wasn't for me. It was for my friend here. Let's see. Well, I guess it kind of was a shameless plug because I'm going to be on a show. He has a show coming up the weekend after next, because he just had one this past Saturday. I was not in attendance. I heard it was hot. I heard it was horny. I only used that second word because it was an alliteration to hot. You can tell that I am
Horny
rambling.
was right.
Horny was right.
Horny
Okay,
was right.
Good. Are you ready, Greg? Throw on that lab coat,
Oh, yeah.
Mr. Teacher. And Jared, you can go ahead and come out and look like you're going to learn something. Is this what it looks like to learn?
This is my learning face.
This is your learning
This
face.
is my learning face.
Great. Are we ready? It looks like you are.
I'm ready.
We have very loud music coming in from the corner of the room, but he
Oh,
can't
that's
hear us because
just-
the music's so loud.
That's just Tim being Tim.
That's Tim being Tim. We have 5 minutes on the clock. Let's change that bottom lower thirds from shock therapy to prostate cancer. And 5 minutes on the clock.
And
Get
then
ready,
is that
go.
I'm going?
Yes.
Okay.
All right.
All right. So prostate cancer. The way that we figure out if prostate cancer is truly there or not, it's the number one cancer that affects men specifically, so worth knowing about. So we typically talk about screening first for risk of having prostate cancer by getting your PSA level, which is broken down into free PSA and total PSA. That'll be important in a second.
Okay.
But ultimately, to have a definitive diagnosis, you want to do a biopsy that'll actually show you cancer cells or not. But you don't want to stick a needle into someone's prostate because you have to go through the rectum to get there, unless you know that there's a high chance that you're going to find something worth treating.
Not true.
So, I mean, you can do it electively, I guess. But if you do electively, it's more fun. But
I actually have some kind of not expertise, but experience in this.
oh, really?
stuff going into the rectum, but that's
Oh,
not here
interesting.
nor there.
Okay. That's maybe another conversation.
Next week on Expert Fact.
Backing up. So let's talk about why PSA is used. So PSA is a protein that's produced by the secretory cells in the prostate organ. And so what happens, the sort of chain of events, is the secretory cell of the prostate produces what's called pro-PSA. That goes out into the circulation and then gets cleaved by enzymes in the circulation, and then it's turned into active PSA. PSA is then in circulation broken down into inactive PSA. So that is what's the free. When we say free PSA, we actually mean inactivated PSA.
You get all that, Jared?
The reason
so
why
it's like extra PSA that's just hanging around
Yeah, so it's just your regular circulating PSA.
because it doesn't all get attached with those enzymes.
Yeah.
And everything like that.
Yeah, well, it got hit by the enzymes, and so now it's been inactivated.
Okay.
Yeah,
All right.
yeah,
I think I got you.
yes. So the
So if
significance.
it's already been like a dirty whore. It's already been used.
Oh yeah, it's used up and thrown away. So so when you're measuring free and total PSA in a normal person, they're going to have a baseline amount of free PSA and a fairly relatively similar amount of total PSA that just shows you that the system is working normally. However, in a state of cancer, the cancer cells, the architecture of the cancer cells is really shitty, and so you have a leak of the PSA out into the circulation.
2
and so
minutes.
You end up with a lot more PSA not getting through the process like this normally, and so your free PSA is sometimes normal or low, but your total goes way up.
Okay, so it just makes it more like it dilates the PSA to flow through more because of the cancer cells making it
Yeah, because they're just
faulty.
Yeah, so you have this huge amount of cells, and they're just spilling all this protein out into the circulation, and it's not being processed normally. And so you're going to have an increase in amount of things that get picked up looking like PSA, but they're not going to have been cleaved like the normal inactive PSA. So you see someone who has this change, now you have a much higher index of suspicion to think this could be prostate cancer, but you have to correlate it clinically with other things. So lastly, the differential is that there are other things that can raise your PSA. Things like
1 minute.
prostatic hypertrophy, BPH was the most common condition that happens in older men, but also like an infection or trauma in the area around your prostate can all cause increases in PSA. So you need to make sure you can correlate that by doing a prostate exam. And if you feel a painless, lumpy prostate, now you have a good reason with this up and this normal to low. Now it's worth trying to biopsy it.
Okay, that's when you actually stick something in the rectum.
Yeah, you take a bunch of samples and then you send them to a guy in a lab who looks at them.
Just dressed up just like you.
Yeah, it looks exactly like me. They're usually a lot more rich though.
Well, okay.
15 seconds.
So
I can't wait till I have my rectum banged through this.
I mean, it's all gonna happen to most of us at some
Eventually,
point in time.
as you like get older,
Yeah.
eventually like you're gonna die of prostate cancer.
Time is up. All right. Go ahead and leave that microphone there. Take off that sexy, sexy lab coat. Hand it over to Mr. Jared Berniger. And sit over here with me on the couch. Papa squat. Mama squat. I love this. I love this. I love this. I just figured out a new joke that I'm going to write down after this.
Yeah. You want to write it down now? I'd just be typing it on my phone if I were
I mean,
you.
it's the same exact joke I had as before, the Papa Boner, Mama Boner.
Okay. And
Yeah.
then you just said mama squat?
I said Papa squat, Mama squat.
Oh, yes.
Oh, you got it. You just got it.
I just got
You
your
just got
joke.
it. That's okay.
When you said the joke before, I was so unimpressed by it, I didn't even realize you were joking.
That is most of my life,
Okay.
actually. Thank you for inviting me to the basement.
Yeah, no, I like to have shitty comics go up to bring up the good
The
ones.
good, yeah, because then it's like this is the baseline. This is what you have
This is why
to.
I'm on first.
This is why Jared's on first, of course. He's talking specifically. Have you ever done stand up?
Never done.
No, you got to try out some stand up sometime. So, Greg, how did you think that went?
I felt good about it. I got through this a lot better because it's much more concrete concepts that I've seen day to day. The ECT stuff is a little more complex and a lot more theoretical.
Okay.
But I think we got through it. We were able to do a little bit of teach back and kind of talk about what's happening. So that like we kind of got it to check in to see if he actually got any understanding of what we were talking about.
It seems like there was a point where he did understand what was going on.
Yeah.
Is that?
But just as like a erase the board.
Oh, he erased the board and it's all gone now. Just as a reminder, eat those mics, guys. They're going to be the lifeblood of this stream. And Snappy C, you are learning because science is cool. And because who doesn't want to know about we all have to be there. What, age 40, I think it is, right, for prostate cancer checks?
Depends. 40, 45. There's so many guidelines out there that it depends on who you ask.
Okay. Just make sure to get it done at some point.
Talk to your doctor.
Talk to your doctor.
A real doctor.
Jared, are you ready?
Like I said, I just erased my whole memory, so let's see how this goes.
You erased your whole memory.
Yes.
You
That's
got this,
perfect.
Jarrett.
I believe it's 4 minutes on the clock, right? Because then it's 3 and then 2 and 2. Yep, that makes sense to me.
You want to give me less time?
I want to give you 4 minutes is what I'm going to give you.
Okay.
Oh, let me tell you about those
Yeah,
variables.
Yeah, we have
that we have.
variables.
You got
Okay.
3 of 4 variables to use here. So, let's see. I'm going to tell you all 4, and then I want you to choose 3 of them.
Okay.
At the end of every sentence, the Schmexpert has to say it's morphin time. Number 2, they have to teach it left-handed because all of our comedians are right-handed. Number 3, they can't use the letter S. And number 4, Rusty has to rap. So that one's pretty specific.
Yeah.
So which one do you want to get rid of?
So I think let's go with the letter S thing. Like fucks me up. I think we should
It fucks
cut
you
that
up.
one. Yeah,
But it's supposed to fuck them up.
Yeah, but it's just we're gonna spend so much time just like blanking out.
Okay.
Whereas like everything else will be just fine.
Okay. All right. Do we want to give Jared one of these?
Yeah, but he should do It's Morphin Time.
You want to do it? All right. So at the end of every sentence,
my favorite show when I was in 6th grade.
then this is perfect because you're going to say it 100 times.
All
Probably.
right.
At the end of every sentence, you have to say it's morphin time.
This actually might pull it out to 4 minutes.
You got
All
this.
right, 4 minutes on the clock, and let's go.
All right. So we are here in class today, student, to learn about prostate cancer. And
Hey, you have to say it's morphin time, and you have to put that mic up to your mouth.
okay, and it's
2 challenges.
It's morphin time. This is a big challenge because I'm not used to talking into a microphone. Okay, so
What time is it?
Morphin time. So prostate cancer. Morphin time. It's morphin time. So you first start off with
Yeah.
a screening. It's morphin time. Yes, and so
Fuck you guys.
it's separated into 2 different things. What they look for is a PSA, and I think
Now with the
a free
rapping portion, can we just have him rap in the background, or should we have him rap
PSA.
Or he's gonna rap the
PSA.
the lesson?
I think
Okay, because it would be kind of funny if like we're doing a lesson and he's just rapping in the
It's
other
morphin time.
Okay. PSA, free PSA.
And for the diagnosis, what they really have to do is
Zach, can we uncover
is,
Jared's face? It's not your fault. Don't worry about it.
what they have to do is I can't even. This freaking marker sucks.
Hey, what time is it, Jared?
It's morphin time.
It's been a while.
It's a biopsy. I'm not a great speller, but that's what I think it is. And it's morphin time right now.
Okay.
Right
So,
now.
but to do the biopsy, they have different things that they have to look into before they actually do that because
Like your
it's
eyes.
Exactly, it's morphin time.
Okay.
And
He's just doing it every 5 sentences, not at the end of every sentence.
it's.
I appreciate that he's.
I
going for
think
it, though.
I stopped and stop. Okay, it's morphin time. So to do the biopsy, it's morphin time.
That was like a comma, but that's cool.
Period. Whatever the
To
period.
do the
comma.
You have
biopsy.
2 minutes,
and then-
Jared. It's
Okay.
morphin
Oh
time.
shit! It's morphin time. What they would have to do is actually
could've
go
put that one
into
up
the
pretty bad.
rectum
Dude,
with
that's a good one.
take some samples. It's morphin time.
Samples of.
His voice gets
Of
louder.
what they think is the prostate cancer. It's
It's like a
morphin time.
reset.
But there's stuff that they have to get to before they do that. So this is just a butthole because I don't remember exactly what it was supposed to be. It's morphin time. So when they're looking into it, they're
Takes a
looking
little
for
time.
two secretory cells these are cells that secrete from the mucous membrane. It's morphin time.
Okay.
Um,
Mucous membrane.
so
I mean, you know.
they're looking for those two PSA kind of like chain reactions. So there's a PSA. It's morphin time that cuts it into I think the free
throwing it in
PSA. What I was
I-
talking about earlier. It's
I'll take
morphin
it.
time.
What's a PSA? Do we know that, or is that?
I didn't ask that. and
Okay,
I
it's
really
probably not
should. I had
important. It's
time.
probably-
It's
yeah.
morphin time though. Let me tell you that.
1 minute.
So it's cleaved by enzymes and stuff like that.
The butt.
No, these the PSA proase, I think he said the
So every time he says
the
it,
protein is
Zach's
Is
throwing up
cleaned by
like this.
enzymes.
yes this protease cleaves it to where it's to make it a free PSA.
30 seconds.
I didn't ask that. It's morphin
Okay.
time. That's all I know. Jesus Christ. And oh shit, I totally forgot exactly where this.
You got
went.
this, Jared. You have 15 seconds.
Okay.
You
What's
got
the
this.
differential?
Differential. They're looking for the stuff that's so the
Different.
cancer, if it's there, will
5.
cleave.
Morphin time.
It's morphin time. God damn it.
And time. Good job, Jared.
Okay. No, I think I got it all.
Jared got 2
I think-
of
You know
3.
that it's morphin time.
Yeah.
It's morphin
Okay.
time.
I think
It
I
was
got all
good.
that.
Yeah. So how do you feel now that you've been able to say that probably more times than you've ever said it in your life?
I was more concentrated on that. trying to do this. So
Well, I feel like you actually taught a couple of things that actually had
Yeah, you
some
got to
sense to them.
some things
Yeah, so
like the biopsy, and you were talking about PSA and there being different forms.
and I totally like I wanted to ask what it was when I was there.
Yeah,
but,
Yeah.
like, we had time. And I was like, I should ask this, but I didn't.
he wanted to ask and he didn't ask.
And I
that-
didn't
that's
ask,
fine.
so-
it's totally fine. But that's okay. If you want to relieve the lab coat and hand it over to
Good luck.
Thank you. I think I got a lot to go off of.
to what I think is going to be an alter ego of
Oh, yeah.
Rusty Rutherford at the
Snap.
moment. There's different names for that too, like
Yeah.
what's it called? Like when you have like a pen name but for rappers.
Your
Yeah.
MC name?
Yeah,
Your-
okay. Yeah,
your,
that's fine. That's okay.
street
Deltron
name?
4040 or 2020's got like a bunch
30-30.
of different 3030.
3030.
Just
Yeah,
average
he's got
it.
a bunch of different ones.
I just averaged. It's morphin time. I'm gonna have that stuck in my head. I think it's gonna be Phil this time. Yeah, it's morphin time. I'm not gonna be able to get that out of my head. I'm gonna hear Jared in my sleep tonight. It's morphin time.
Enthusiastically saying it's
Enthusiastically
morphin time.
say. So you missed all of the fun. Please go back and watch this because Jared had to say it's morphin time at the end of every sentence.
Oh wow.
And
Yeah.
He actually morphed at the end of it.
yeah, he's actually gone.
Yeah.
So how are you feeling, Mr. Rusty Rutherford?
I am feeling not too confident about the information I have, but it's cool, man.
Would you feel more confident as Rusta Rhymes?
Oh, fuck yeah.
Hell yeah. All right,
right.
we got 3 minutes on that clock.
All right.
We got 3 minutes on
We're
the
gonna
clock.
do this
All right,
just
are you ready to go, Mr. Rusty?
Yo, let's
Mr. Rusta.
let's
Rusta.
do this. Rusty's my
All right,
slave name.
Rusta Rhymes on the clock. 3 minutes, go.
All right, yo, check it. This is all about doing stuff, I reckon, all the way from the prostate through the rectum. This is what we call a screen diagnosis. It's where they screen your prostate to see if you have comatosis. Okay, here we go. Pretty
You're gonna
soon
say
you're gonna
comatosis.
learn this lesson and it'll make you famous. This looks like a Zia, but it's really an anus. All right, they're gonna poke through here, straight through your rear. So I recommend before you get there, have a couple of beers. They're gonna fill your prostate to see if anything's unusual.
Just threw his
I don't
Zia.
really know. It's
That's all he did.
goofy, I suppose, fool. Okay, this is your prostate, which I think is near your penis. I don't really know. On Mercury, Mars, on the way to Venus. All right, so Here's what they say. They say there's two different things. There's a PSA. You might think that stands for public service announcement, but it doesn't. Stands for something else, like a second-hand cousin. Some PSAs cost money, but others are free. This is a free PSA.
For yes.
For you, SA. All right, here we go. What the hell? I guess I'll move on to the secretary cell. Yeah, that's all the information I got. Don't worry, you'll be just fine. Pretty much all he told me is that it's morphin' time. Okay, so I'm back to the secretion cell. This is, how do I explain it? Well, it's kind of like when they see if your cell's secreting, and then they clean it with some enzymes after you're done eating. And you can't eat for 24 hours before this test because they put you to sleep. That's just a guess. Okay, so I'm back. Secretion cell. They clean it with these things. They're like, I'm sure you'll be just fine. The things they clean it with, they're called enzymes. Enzymes are going to clean the cell. 1 minute to win it. Here we go. I've just started to begin it. Shit. Differential. Differential. That's a different word for meaning different things. So they see if there's any differential cells near your spleen. But it's not in your spleen, it's in your prostate. Because we're talking about prostate cancer. Okay? I'm a rapper. Not a dancer.
Right, cancer does
so,
rhyme with rapper.
You know,
It's one of those hidden rhymes
this
within the
is
word.
something that's will be just fine. This is something they call the benign diagram. So, prostate is always funny. Cancer is never funny. So in the middle is the gold spot. Okay? This is where they reach, right in the gold spot. That's where they reach to check your prostate to see if there's any differentials. I don't know, that might sound temperamental, but I think you got this lesson plast. I think you just aced this class.
2, 1.
Respect.
Boom!
Nice.
Respect.
Respect.
Resta.
I dig it.
Yeah.
So.
You got
I
everything.
think I got everything I need to know.
Good.
I am well
Absolutely.
educated. I'm going to
Good.
take Greg's job right after this.
Yeah.
All this information.
That is the best thing I've ever seen drawn. It is a Venn diagram of cancer and what?
Prostate.
Prostate. And where the Venn diagram meets is where we check for the cancer.
Yeah.
And it's a dark hole between prostate and cancer.
Yeah, it's a Black Mirror thing.
So how'd you feel, Resta Rhymes?
You know, I felt pretty good.
Felt good, okay.
Yeah, I feel like I got all the information out, and more.
Okay. I think and more is the...
Yeah. Yeah. So yeah, I think Phil's gonna do great. The student has become the teacher, you know?
It's true.
You look like a master
Thank
already.
you.
Yeah.
It's the hair.
One of my questions is, did you ever think that there'd be a time in your life where you'd be rhyming about secretary cells, prostate cancer, in such a linguistic fashion?
Yeah, yeah. In middle school, the song by Juvenile, "Back That Ass Up," came out. And I was like, I want to do a version of this song, but that's more medically inclined. And I finally got my chance. So.
Yes.
Well, and it's
Happened.
about time we do some rap about men.
I know, man. Everything's about women. It's time that men take back hip hop.
Take back it.
Yeah.
Well, you heard it here first. Resta Rhymes taking back hip hop for men. Let's get our next comedian up, Mr. Tim Wolf. I think he's still in the headphone zone. That's a new word that I came up with.
Headphone zone,
But
I
I
like
feel
it.
like that's where it should be called.
Put it up on the
headphone
wall. Yeah.
zone. Yeah, yeah.
You can use that when you're not doing the show.
The headphone zone?
Yeah.
Yeah, I'll stick my girlfriend in the corner.
Yeah, be like, babe, get in the headphone zone, please.
Yeah, it's my.
I just cooked some food. Could you get in the headphone zone and eat some of it?
That's where we eat. Also.
Yeah, don't you have a table over there?
That's true. I do have it. Oh, I see. It is the actual zone of my. Okay, got it.
It's also known as the danger zone.
Danger zone / headphone zone / my girlfriend and I eat dinner.
Have you ever had Danger on one of your shows?
I haven't.
Well, we can put him in there.
Let's put him in the headphone zone.
Yeah.
And
Also
the
known as
danger
Danger
zone.
zone. How are you feeling?
I'm feeling ready to be enlightened.
You missed a handful of things here. We had it's morphin time at the end of every sentence as one of our wrenches. We had Resta Rhymes rap about prostate cancer.
Well, it sounds like a fistful of things.
It is a fistful. In fact, our last wrench to be thrown in is that they have to teach left-handed. Now, do you want to give that to Phil or Tim?
Ooh. Let's Let's just give it to Phil. Keep
Okay.
the show rolling.
Let's keep the show rolling. Phil. That means I want to get the fuck out of here.
Yeah.
I can read between the lines.
I
My
gotta
name is
go.
Dylan.
When it's
And
with
2 minutes on the clock. Phil, are you ready?
Oh, I'm ready.
Left-handed Phil, go.
it's like a whole different person.
Oh yeah, that's right. I want you to
Yeah.
call me Inspector Phil because I'm
Yeah.
gonna inspect your prostate
Oh,
for cancer.
hell yeah.
That's what the lesson is today: prostate cancer awareness. That's right. Everyone knows that prostate cancers. Oh God, this is even worse than my rail handwriting.
But at least you can read it.
Well, maybe because I just wrote PAS instead of PSA. So, prostate cancer, it needs to be done by a PSA, which stands, you would think that stands for prostate state awareness, but no, it stands for public service announcement.
Is
and
that
they're
the
free.
prostate? That's
No,
what-
we will get to that beautiful little thing here. So, the screening, of course, your anus looks like a Zia
How would you know?
because I've looked at one or two.
Looked at mine?
Rusta Rhyme showed me a few on his phone.
You don't know mine, though.
So, so this Zia here, it also looks almost like the symbol for Godsmack, that old band. Anyone
Yeah,
remember that?
Godsmack.
Yeah, it looks like that, but really, this is the anus, and this is where you gotta,
I don't think you like
gotta
that band
fill it
very
up. I
much.
don't really care for them that much, but right over here is where you gotta reach and feel. So here's gonna
Is
be
this how
your.
babies are made?
This is if men gave birth, yes, they would come out through this one. It would stretch. We're going on to a different topic. You want to make sure your nails are trimmed.
That's a really long nail. They're trimmed. What the fuck?
Well, no, this isn't. So this is no.
Is it a
You wanna make
penis?
sure-
That
No,
looks like a
that's
penis.
finger.
The
Can't you tell?
balls,
the
the
knuckle.
glands,
It's got like
the
4 knuckles.
shaft. There's knuckles on your penis. All right.
Okay,
Whatever.
well, this is his wristwatch.
The balls.
It may
and
look
then
like
use
hair.
the
Yeah, if
proper
your penis is big, it's
anatomical
pubes, yes,
term, the
that's
glands. And
So
then jump back into the
this is
shaft.
where you're gonna go ahead and reach your finger in to see if this is inflamed or enlarged.
Is
I've
that
heard
the
those
poop?
things. No, this is your gland.
Gland.
Gland. I'm just gonna go all over there. Oh, what? It's only time.
Oh.
At the time, too. I was
We were
so
into
enthralled.
it.
I couldn't help it.
I was like, oh damn, that went by way too fast.
Well, how did you feel about that, Phil?
Not very well.
Okay,
I didn't
alright.
even get to the second point.
The secretary cell isn't as important.
It's not that
I mean,
important,
it makes
as we
the
all.
office run, but it's not. It's no knuckle gland.
Yeah,
Whatever that
it's-
thing-
Yeah, don't worry about it. You'll be fine. Just go to a real doctor and get tested, and you'll be okay.
So if you can hand over your lab coat to Mr. Tim Wolf, where Tim Wolf will get our last variable to be thrown in, right? And so, oh no, he's not going to. Yeah, that is it. He's going to do what he can with what he has. So Mr. Tim Wolf is going to be explaining to our seemingly, I've been using that word a lot. It's just fun to use.
Seemingly.
Our seemingly, and I'm just going to stop talking.
Okay.
He's going to talk to our seemingly.
Okay.
So we have 2 minutes on the clock, and Tim Wolf is going to do a little mini lecture without a marker this time, it looks like.
Yeah.
Yeah, he's just ready to
got
get
it.
going.
I've got my hand is ready.
His hand is ready. Oh, he's going to do the real prostate. This is the last lecture of the night.
Yeah.
Tim Wolf, are you ready?
Yes.
Prostate.
All right. So prostate cancer awareness. It's important because if you get prostate cancer, you might die. All right. So how are we going to screen for this and diagnose this? Well, you got to identify the prostate. It looks like a Zia symbol, especially that lame-ass one with the bacon and eggs. I don't get that. Then you're going to have a nicely manicured finger that doesn't look like a penis. This one definitely does. Don't even try to tell me it doesn't. It's going to go in the anus. It's going to feel around. I'm assuming it's going to feel this. It's not poop, evidently. It's your it's your gland. What's it secreting? I don't know.
That says
Maybe
glab.
Glenn, I know you're watching. Anyway, that gland's is probably secreting. It's the secretary cell from Dragon Ball Z. Cell, he's a secretary. You gotta
Cell
check
was
for
on
that.
Dragon Ball Z.
Cell from Dragon Ball Z.
Oh, I didn't.
After the Frieza arc. Come on, people.
You have 1 minute left to explain.
Someone in the
Dragon
comments
Ball
All
is
Z.
gonna
right. So you're looking for
roast
the
me so hard.
differential. Is that the gear differential? Is it differential equations? Hopefully not. That class sucked. All I know is I remember getting a prostate exam, and my doctor was talking about the difference between like my baseline urine in there, and then how much urine's in that you like fill up. If you got the wrong amount of urine differential, you probably is going to be a problem. There wasn't a problem for me. I'm perfectly healthy. Thank you very much. I've got my test results. It's a clean bill of health. I had an ex-girlfriend.
I feel like you're really
no
specifically
labels,
talking to
but
somebody,
you know
right?
she's basically my girlfriend. And she gave me making all these tests,
Is this
and I
all
was
the
clean.
Glenn?
No, her name was not Glenn.
Oh, okay.
But maybe she's fucking Glenn now. She sleeps around. I was clean. All right?
15 seconds.
That's what you need to know here. My prostate's fine. My penis finger's fine. And Greg is really fine. Look at that.
5 seconds.
I know, right?
3.
I bet he's got a
2,
great prostate.
1.
It's healthy.
All right. Thank you. That was fun. That was unexpected left-hand turns there.
Excellent.
Just it kept going left. It never stopped. Nor is that beeper going to stop. I
Right
don't
into a
think. We'll
tree.
see.
That's how I like to drive.
We'll see. See if we can get it to
Excellent.
stop.
Oh.
There we go. We did it.
Interesting.
All right. That is interesting. So,
That was amazing.
Why don't you sit back over here with me?
Yeah, I'll
Greg?
take a seat.
And we'll get all the comedians out here.
All right.
And we'll let's do a thorough examination of the prostate examination. That's
Yeah.
the winner gets a free. How much would
Yeah.
a prostate exam cost, Greg?
I don't know what the billing and comes out to.
I'm gonna guess.
But it's definitely it's a
$5.
billable procedure.
It seems like a $5 exam.
Do you definitely you don't have any knowledge of billing through medical school and stuff like that?
No, we.
I mean, I imagine
we
that's not what
don't-
they focus on, but
we don't have any formal discussion,
Okay.
but there's more of a conversation in medical training in general to teach people how to better code in
Okay.
general. UNM has a weird system though because they have a coding department of people who go through your notes and then pull codes from your notes.
Oh, really?
And so you have to use really specific language in your notes when you're describing certain things to differentiate whatever diagnosis code or procedure code that you need. And so sometimes they'll send you messages about what happened in the chart. So I've gone to lectures where they discuss how to sort of streamline your note writing so that it is better for billing. So then the billing people don't have to.
They're going to
like
feel
keep
around.
those
They're going to
lines.
feel around up in your notes like a prostate exam.
And if it's
gonna pull it out.
Well, it's not often we have a prostate teacher here. Mr. Prostate, can I call you?
you can call me Dr. Prostate.
But it's not often we have a Dr. Prostate. So does
Actually,
anybody have any
you know
more?
what? Dr. Prostate's my dad's name. Just call me Cancer.
Does anybody else have any cancer or prostate or shock therapy questions for Mr. Greg Schmexpert?
What does PSA stand for?
Prostate-specific antigen.
Oh,
That is what PSA stands for.
And so if you're on Medicaid, you get free PSA. That's what the free PSA was.
It's your circulating PSA.
Duh, everybody. You've been paying attention to one.
Sorry.
What does circulating mean?
So it's in your blood. It's the normally processed protein that's in your blood. So when they test your PSA, it's a blood test.
I've had enough of these Medicaid people circulating PSA all around our communities.
Tim's.
I feel like this is kind of a pseudoscience, right? Has it been tested?
This is the Ouija board of
Yeah,
science.
is there a doctor? Yeah, there's a patent going around.
Yeah.
Might
Well,
explain-
the only controversy in prostate cancer screening is that we used to be way too aggressive about it.
Go
and so A lot
on.
of people were getting biopsies who didn't need them, and one risk of biopsying is you can hit the nerves that innervate the penis, and you can give people permanent erectile dysfunction that you can't fix with
Now
Viagra.
nobody's gonna get a prostate exam. You shouldn't have said that.
Well, usually the people who get prostate cancer end up dying of other things, and so often, unless it's very invasive, they won't treat it. So we've really pumped the brakes on treating prostate cancer. It's really only in young people that we're worried about it. So people do get surgery and other treatments for prostate cancer, but it's in really specific circumstances because we were overdiagnosing and overtreating it. And when we were realizing we can just watch and wait with most people, and people with old age who get prostate cancer will die of something
Just
else.
watch them die.
They just it's just not going to kill them.
Like a car wreck or something.
Right.
Sit him down there.
Most people would. But like there are interesting surgeries to try to fix that. Like you can get like a pump, like literally an air balloon that you pump through your balls to like make an erection. There's a lot of very interesting technology.
Can we try that? Because sometimes I just get really nervous when the moment comes.
I need a little balloon.
Yeah, just if you could just have a little bit of help.
That could be foreplay. Just have her blow it up while it's in
Yeah.
you.
That's how you make it sexy.
Do you blow it
Yeah.
up once it's in you, or do you blow it up and then put the balloon in?
No.
Order of operations is very
Yeah.
important.
You're gonna have to talk to your surgeon. Maybe you can bring your own stuff.
I got my own balloon down.
Yeah, you're like, no, I want this bigger one.
Yeah.
BYOB.
We all know
Yeah.
a clown now.
Bring your own balloon.
Oh yeah, no, that's true.
Skin is very stretchy, so I mean, you
Yeah.
can just go any size you really want.
It's like I want mine in the shape of a dog. So
Yeah.
My dick looks like a monkey.
These are educational dick jokes.
Yes.
yes. These are
Don't ban
highbrow.
us,
We're
Twitch.
highbrow here at Color Circuit.
Yeah.
No.
Does anybody have any other questions for Greg?
This is really fascinating. I think I'm honestly gonna go back and see what he talked about because I'm like, oh man, like I feel like I should know more about this.
This is actually, important information.
Google
Yeah.
it, probably.
Oh, that's
Better bet.
And
Yeah.
make
probably-
sure you play with your
You can
balls for
find,
testicular cancer.
There's a website called Online MedEd, and you can search that. It's free online, and you can look up the video that breaks this all down.
Oh really?
That was kind of a free PSA you just gave.
Hey.
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 Response-
I'm
so-
paying that guy $40 a month for submission. Anyways,
Last thing before the last thing. What did you guys learn today?
It's morphin time.
You learned that it's morphin time, okay?
I learned we could have saved Dee Dee Ramone with ECT.
I learned that the Zia symbol looks like an anus.
I learned
Yeah.
that it looks like bacon and eggs.
Yeah.
I've never heard that before.
A lot of people have that tattoo.
Of an anus? Oh, or the Zia.
yeah, arguably maybe it is
in
an
the
anus.
same spot
Same.
between the cheeks.
I learned that electroshock therapy is the reason that Trump is in office today.
Because he got too much of it or
Because
too
he-
little?
Because he didn't get it. And it cuts off the right. The rights.
The right.
Because they
Oh, yeah.
put the tourniquet on the wrong
But
way.
they should have done it old school style.
Yeah.
Yeah.
Too bad.
It goes on the right. I learned that too. Where in the Crips, it always goes on the left. When Crips wear it.
Mm.
But when you're getting it for electroshock therapy, on the right. So don't put it on the wrong one, or you might be mistaken for a Crip.
That's why we
Or a
always
shock therapy.
Shock victim.
Victim.
or not victim, yeah.
Victim.
we usually tell our patients if they're in a gang, please wear your colors when you come in for treatment, so we don't fuck.
We
this
want to
up.
make sure we separate you guys
Yeah.
in the right
You're just
order.
taking a crip into the shock therapy.
No, yeah, just to chill though.
Yeah,
Like
yeah,
you're
they
saying,
should,
yeah.
all right. Well, thank you, everybody. Thank you, Greg. Thank you, Jared, Tim, whatever your name is.
We don't get a final
and
grade?
Rest of Rhymes. Yeah.
Yeah, what's our grade?
What's our final grade?
Oh,
I
I feel
You should
like
host
you
this
guys
show.
brought it up to like I think you brought it up to like a D plus.
Oh, we got a
Ah,
plus.
that's
In some
good.
schools, that's a pass.
Yeah,
So-
overall,
I
then, that
Proud of
averages
everyone
out
here.
to a D.
Yeah,
Good job, everybody.
nice use of
Dylan, we
averaging.
give you a C minus
second
for
time in one
hosting.
show.
C minus for hosting. That means we brought everybody up to a D plus. I don't know
All
if that
right.
works out.
We brought to
Oh,
a P
almost
for
a C
prostate.
There we
I have a
go.
higher weighted average
Oh, do you?
on my side.
Mm.
Yes.
On your side.
Can we all on three say it's morphin time?
Sure.
For Jared.
Sure.
All right, 1, 2, 3.
It's morphin time!
Tune in tomorrow, 7 p.m. Tales from the Undertaker.
Do, 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 do. Do, 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 do.